Hi, I'm Von. I'm an ICU nurse in a private hospital here in the UK.
Before we continue, this video is sponsored by Briley Care, the agency that truly cares.
Sorry, no shifts for you this week.
Why not call Briley Care?
Briley Care has guaranteed shifts all over London. They would reward, incentivize, and recognize you, their staff, and also provide 24/7 support. In fact, I've got my good friend Paul, Managing Director and owner of Briley Care, with a little message for you.
My company's tagline is Briley Care, the agency that truly cares.
Briley Care, the agency that truly cares.
So working in a private hospital gives you a lot of benefits as well. Aside from the good benefit on compensation, they usually allow like annual review of your performance, and then that review is a basis for your increase on your annual salary. Same is true with a contribution on your pension scheme. And what's exciting is they also contribute in giving you an access to their healthcare acute private facilities in terms of you want to visit their private GPs or access to medical care. So that's also an advantage of working in a private hospital. And of course, as nurses, we also want skills enhancement. They also provide trainings. Same with the NHS, except that we are a smaller family and they can pwede ka nilang tutukan on your professional growth. So it's really fun to work in a private setting as well. Okay, so in terms of, they said cons, I would not want to call it cons. It's usually, I think it's more of a challenge to the healthcare practitioners. Working in a private hospital gives you a lot of challenges. Number one, in a private setting, you work with the private doctors, private consultants, and each consultant has different approach in managing patients. Unlike in the NHS, you have a one go of protocols based on the research and guidelines. But in a private setting, it varies because one consultant has a different practice from one or to another. So it's one of the differences of a private setting to the NHS. And maybe on the compensation disadvantages, they say for ladies out there, it's been known that the private settings as well, or the private healthcare institution gives, I think, a lesser maternity leave. If you want to know about it, you can Google it. I think you can know more about these packages in depth. You can ask the HR, you can ask also the employer for them to be able to give you a much more clearer benefits and difference in terms of this leave. In terms of packages as well, like say maternity leave, the female or the ladies from the NHS or the female nurses from the NHS enjoys a lot of maternity leave packages, while on the private settings they also enjoy it, but it has a lesser number of months. I think the cons would not become a hindrance for you to be able to work happily in a private setting. So I'll talk to you about the salary of a private hospital in a personal note. What I mean is, like, in each private hospital, they offer different compensation packages. So what I can talk about is my private institution. So, but it's almost the same in every institution. So usually, in general, they offer like £31,000 to £35,000 as a starting compensation or salary, but that does not yet include the 9% enhancement in a year. If you have, like, say, completed, you are in a special area and you've completed specialized courses, they usually give bonuses as well, or another couple of pounds on top of your annual salary. Say for example, I am taking my ICU course at the moment, and my private institution or my hospital would give me like say 2,000 to 3,000 pounds on top of the annual salary, and that would make a lot of difference, isn't it, in terms of your basic salary. Plus, don't forget also your bank enhancements. They also give generous amount of bank enhancement per hour. Say it would range maybe, let's say on a weekday, let's give it like 25 to 30, like night shifts, and weekends and holidays like 35 to 37. So it really depends on different institutions, but I can say that's the general range of every salary. So the main thing here is, at the end of the day, we came here in the UK, we would want to enjoy our salary. At the same time, we would want to help our family. So I think I have discussed that one with you on my latest vlog actually. So if you want to visit my channel, you can just visit there. I've made a difference of NHS salary versus the private setting salary. Okay, so for the tips, those of you who would want to transfer to private settings, I would just give you 3 tips. Number 1, know your contract, your current contract. If your hospital at the moment has a contract with you in terms of, or has a binding contract, discuss it with them. Maybe you can talk to your HR if you have some current issues or some questions with regards to leaving your current employer, and then you would want to venture to a greener pasture. That should be considered because of course we came here for with a visa and with a sponsorship, so that's important. Number 2, find a hospital that would not only give you a better compensation but would maybe enhance your skills. It's not just because you would want to earn money, but of course you would want to explore your skills, would want to progress with your profession. And then third thing is just enjoy all the opportunities you have here in the UK. May it be like, say, if you want to transfer to a private hospital here in central London or wherever it is in the UK, just make sure that your decision, you can enjoy it at the same time, you don't add pressure to yourself, and just stay cool with it, because at the end of the day, you will not just work and work. Of course, you also have to explore whatever opportunities you will have here in the UK, and of course you can send some help and support with your family or to your family back there in the Philippines. So just enjoy life here in the UK and you'll be okay. Manong knows. So I hope you enjoyed this video. If you would want more information about nursing, life here in the UK, don't forget to just subscribe in this channel. Drop some comments below, hit the thumb button, and then hit the bell so that you can get some notification. And of course, don't hesitate to share this with your friends. Always visit Manong George's channel and my channel as well, because I also make my channel. So it's Eric Von Fredeluces. And of course, always remember, Manong knows.
Manong knows best.